I'm Debbie Statler, Editor-in-Chief of Provider Magazine. Today I'm here with Tom Syverson, Director of Government Relations for the Evangelical Lutheran Good Samaritan Society. Thanks for being with us.
Yeah, very glad to be here with you.
Well, let's start at the beginning. How did you get involved in long-term care?
Well, I grew up in a small rural community in southwest Minnesota and always had my elders around me. And so as I went to college, kind of drew me into this field. And I've been with the Good Samaritan Society now for 36 years. Started as an administrator and worked through various positions in operations. And then about 3 years ago, we came together with Sanford Health. And at that time, I made the transition into government relations. I had done work more on a volunteer basis with ACA and with NAB, and just have found this to be a great fit for my skills, and I'm really enjoying it.
Wonderful. Well, workforce shortages and staffing regulations are a big focus right now. What are you seeing in terms of those topics for skilled nursing providers?
Sure. Well, actually for a full health continuum like we're seeing it at all levels of the organization. And with the fact that we serve about 70% of our population in deep rural areas, I think there's some unique issues that we deal with that others may not. Sometimes simply there just are now no people to even interview in those rural areas. So in my 36 years working for this organization, I've never seen it like this. And I think that what it really is doing is affecting access for the people we serve. And I take that really personally because I have a unique situation where I've always had at least one of my family members at all times cared for by the Good Samaritan Society. So it becomes very personal to me as well. So I get pretty passionate about the fact that access is just as important as staffing levels as we think about the minimum staffing coming forward with that regulation.
Absolutely, and we've been hearing of people with numbers of beds and facilities closing. I mean, across the country, it's just been a struggle.
And unfortunately for us, serving in deep rural areas, it's always been about, are there enough people to serve, or there are enough staff to serve? And unfortunately, in the last 18 months, we've had to close 13 of our locations, and most of those were in very small communities. And it's heartbreaking when we have to do that. But we're focused on quality care, and if we cannot provide that or don't have the reimbursement, and in those cases in smaller rural communities, you don't have as much Medicare revenue that's coming in, so you're really dependent on the Medicaid revenue from the state as well as your private pay.
Well, you mentioned the minimum staffing rule. What would be the impact of a minimum staffing rule for skilled nursing facilities in your view?
Well, I think it's going to create greater and greater access issues. We've had to close units in some of our bigger buildings, and we've had to limit admissions in many of our locations. I think it also, when you look at healthcare in general, it is an ecosystem. And so our hospitals that we have are struggling to have timely discharges. And so we've been working with American Hospital Association about why it's important to really collaborate and work together to address this issue, because an unfunded mandate that we don't know what the details are going to be yet, but if it is done in such a way that the targets are unrealistic or unachievable in a short time period, it's going to create a ripple effect throughout all of healthcare, not just skilled. But I think for skilled facilities, it's really going to limit the ability to serve more people, but in some cases may end up closing more facilities. And we've already seen 450 plus facilities close across the nation.
Absolutely, unfunded being the operative word there. Well, on the flip side, tell me about some recent successes and wins in advocacy across the states you serve.
Well, I think one of the things that we all realized once the provider relief funds were completely utilized, we needed to refocus at the state level. And so we've really been telling that story at the state level in a variety of ways. Reaching out to our local legislators, having visits, doing op-eds, and I'm very happy to say in all 7 of our core states, we have received Medicaid funding increases, and some very substantial, 20+% in 2 of our states. So, so that has a huge impact on our ability to provide care, especially in our deep rural areas. So that is definitely a success. I think the other thing that we continue to do is continue to build relationships at the national level. We'll be doing visits tomorrow with senators from our 7 core states, and getting those individuals out to visit our locations is really critical. So we've been placing those thoughts as we've been, this is going to be my 3rd or 4th time out here since the beginning of the year, and each time, we're inviting those senator or representative, but equally as important, their staff. And sometimes those staff members coming to visit really helps to inform their boss what the issues are on the ground. So I always tell our administrators that regardless if it's the senator or representative themselves or it's their staff members, either way you treat them the same way. Give them the information. They are just as important as the elected official.
And there's really no substitute for that firsthand experience.
No, that is very true. Yeah.
Well, what advice do you give for providers who might want to get involved more in advocacy at the state or the national level?
I think it's just taking the time. I know people are very busy, and being a part of a larger organization, we're able to have people like myself who are focused just on this. But getting to know your elected official, and it can start with a letter, and we'll be asking all of our administrators and their staff members to write letters now once the minimum staffing rule comes out. And they read those letters, and then copying those to your elected officials, they understand then this is a serious issue. So even starting at that level, but getting to know the individuals who work in those offices, and it just takes a bit of time and focus, and your constituent, you help to elect those officials. So you're reaching out to them, that's part of their job. And so informing people, these individuals have to know a lot about so many different areas. So helping them to understand the struggles that we're dealing with these days, that's the best thing that people can do.
Yeah, they want to hear from their constituents. They want to understand more.
Yeah.
That's great advice. Well, thank you for spending a few minutes today with us. We appreciate it.
Yeah, well, thank you very much.